my name's Tanja Phillips. I'm a GP by background, and I have 3 aesthetic clinics, so one in Hampshire, one in Berkshire, and one in Knightsbridge, just along from Harrods. But I started off knowing absolutely nothing about lasers whatsoever 9 years ago. So my background is in general practice. I qualified 30 years ago, and my driver really was health and well-being for our patients, which I'm sure is what your driver is too. But in general practice, probably a little like dentistry, things have changed quite a lot over the years, and unfortunately it wasn't giving me the job satisfaction that I wanted, and I've moved across into the aesthetics world. I still practice as a GP, so just keep my hand in, which is nice just to see how my colleagues are, but the world of aesthetics is quite different. So I had some experience in primary care setting up new services, so I really wanted to combine some of that skill set in with my skill set as a GP and then start in the laser industry. But I knew, as I say, absolutely nothing, so I started off really on the back foot. But I wanted to start with laser rather than injectables. Now, why would I do that? Most of my colleagues who were dabbling then in aesthetics started with injectables, which was the obvious way to go. But I really wanted to stand out from the crowd and do something a little bit different. I needed something that was evidence-based, had papers to back it up and studies behind it. And I wanted to treat not just aesthetic problems, but medical problems too. So I really wanted to broaden my horizons and look at skin quality and skin care. The other thing I really wanted to do was to expand a team. So as you all know, if you're running your own businesses, if you're the only person doing that work, then actually it's all on you. If you go away on holiday, you're not earning money. So you need a nice team around you. And I wanted that collaborative working with other doctors, dentists, with nurses, and with aesthetic practitioners. And this seemed to be a sensible way forward. So in the audience today, so presumably how many of you are dentists, orthodontists? Yeah? Okay. And are any of you at the moment doing injectables or any aesthetics? Some only. Okay. So this is a whole new world then in that case for you guys. But what you have over and above what I had is you have a captive audience already. So your patients are already used to you doing treatments like teeth whitening, teeth alignment, that kind of thing. So you've got that offering in place, and I didn't have that, and have still managed to be successful in my field. So this is a really good opportunity for you guys to branch into that field. Some dentists are already doing toxins, fillers, threads, and so on. So you've got that opportunity, you've got that captive audience. So if you're looking at lasers, which is quite a different thing to do you want to do laser dentistry? Do you want to do laser aesthetics? Or actually, in an ideal world, would you want a device that actually did both for you? So that may be the better way forward if you're just starting out. So you're spreading your investment over dental and aesthetics. If you're looking to move into buying a device for your clinic or a laser for your clinic, there are a number of things that you need to look for. And what I want to share with you are things that I looked for, what the pitfalls I found were, so how you can really make the best decision for you in your practice. So there are a number of different things that you need to consider. So one of the most important things is, are you going to be able to deliver lots of different treatments, but all of those treatments at a really high quality? So there is no point delivering lots of different treatments if all of them aren't quite getting to, to that mark, to that optimum treatment. So you need something high quality, but you need to be able to deliver a number of different things. So when you've got those patients in your clinic, you're not having to send them off to have something else done elsewhere. And that was really important to me. It takes time to get your patients to get their trust in you, and so you need to be able to deliver, hopefully, everything that they want. Ideally, you want comfort for your patients, so no downtime, the holy grail of treatment optimization and no downtime, and excellent patient satisfaction. Your patients are your walking, talking advert for your business, so they're the ones that are going to get you more patients to come and see you. And you need technology that is always ahead of the curve, so always developing. And in order to do that, you need a device that can be upgraded regularly, rather than getting a device whereby, in a few years' time that may be obsolete and not delivering for you. You need something that's constantly upgraded. I decided on a Photona laser because of that reason. So if new innovation comes out, which it frequently does with Photona, you just get a computer update on your existing device, and all of the treatments try to use existing handpieces rather than you having to invest in another handpiece. The other huge advantage of going down the Photona route is that you don't have any consumables with it. So from the aesthetic side, often with devices, you're having to pay for treatments before you've actually delivered them. So be that pads, be that gels, or you have a card that you put into the device and it counts the number of treatments you offer. So with these lasers, once you have it, that's it, it's yours. You can autoclave all the hand pieces, so you've not got that consumable cost. So it's environmentally friendly too. The other thing that you really need to look for is something that's going to last you long term. So it needs to be able to last for years and years, minimal breakdowns, and keep on going. So a lot of the clinics that have our lasers have had their devices now for 13, 14, 15 years plus. They've still got the same device that they started with and have just had the upgrades on it. So again, rather than having that short lifespan that a lot of devices have for about 5 years, these just keep on going. You need high quality, you need to have low breakdowns, and again, with devices, it's a problem whereby, if you've got something that's unreliable, you're going to be out of action. So again, the devices have a significant reliability. I've again had mine for 9 years and I've never had an issue with it. And you need a good return on your investment. So the treatments that you're delivering stand out when you're going down the route of a laser, because your competition, other clinics, will not have the same as you. So the treatments that I offer, like a 4D facelift, which is essentially lifting that lower part of the face that everyone complains about, you can be charging around £900 per treatment session, and it takes about an hour. So in summary, what you're really looking for in a device, if you're going for something different and you want to expand your portfolio as dentists, is you need to have a multi-platform device. So something that has a number of different wavelengths, not just one. So you don't want a plug-and-play device. So lots of different wavelengths, but high quality. And ideally, if you're starting out, something that does dental endodontics, but also does aesthetics for you as well. And something that actually it doesn't need you to keep doing. So with the Photona devices, a number of the treatments that you can offer can be carried out by nurses as well, but also by aesthetic practitioners too. So it's a good way of developing your team and actually having different people delivering the treatments at different price points. So the SP Dynamis and the Lightwalker are the two sort of stars of the Photona portfolio. And they have erbium YAG and ND YAG within them, so it's a multi-platform device. And there are erbium lasers and ND YAG lasers, but they're not all the same, so there is quite a difference between one laser and another laser. The reason that it's quite different is because Photona technology actually breaks down the pulses quite differently to other devices. So for the erbium YAG, you have very, very short pulse durations, extended to much longer pulse durations. And I'm going to talk about smooth mode in a little bit more detail in a moment, because that is Photona's USP. And then ND YAG, again, Photona have broken it down into microsecond pulses, millisecond pulses, and second pulses. And along that, the treatments are very, very different. So at this level, you're treating things like pore size, inflammation. Here you're treating vessels and hair, and here you're collagen stimulating. Here you're cutting tissue, here you're collagen stimulating, and smooth mode is erbium, which has actually been formulated to be non-ablative. So with the Lightwalker, the dental laser that also delivers on aesthetic treatments, there's a huge number of treatments that you can do from the dental side. But I'm going to be focusing today on the aesthetic side, and my colleague tomorrow, Dr. Eli Madden, will be talking about the dental side as well on the same device. So from the aesthetic side, there's a whole list of treatments that you can do, and the list goes on. So there are actually 100 different applications just on the one device. So when you see clinics where they have maybe 50, 10, 12, 13 plus devices, and they're all doing something different, this you can have all in one machine delivering face and body treatments too, plus dental. So from things like the 4D facelift to smooth eye, where you're lifting above the eye, you can be plumping the lips, you can do fat reduction, you can treat veins, hair, snoring, and much, much more. And then as dentists, you won't be particularly wanting to do this because it's the other end of the body, but vaginal rejuvenation and incontinence. So 100 different treatment options, all within the same device. So I'm going to focus a little bit on erbium. So erbium is traditionally an ablative laser. For those of you that don't know lasers, erbium is known as a cutting device, so it can take things away. So it can work in the dental aspect for taking things away, and it can work on the skin for taking things away, like skin lesions, making microchannels into the skin to stimulate collagen. Non-ablative erbium is something that Photona have devised years ago, and it's never been copied by another laser device, and it's micropulses sub-ablative, so you're not damaging the skin surface. And it's an absolute game changer in our world, because what you're getting is results of an ablative laser, but in a non-ablative way, so minimal downtime, maximum performance. The other advantage is it doesn't have to be a medic that undertakes those treatments. So this is how the micropulses work. So you have a little packet of 6 micropulses, all delivered at the same time on top of each other, with 0 damage to the surface of the skin, but you are getting the heat penetration going in, and it's that heat delivery that's working on the collagen. So what you're doing with your collagen helix is you're breaking the fibers in between, and then they're coming closer together, but you're also stimulating new collagen. So traditional erbium does this, so it's ablative to stimulate the collagen, and the smooth mode is thermal diffusion to stimulate collagen. So the certain treatments that smooth mode can deliver, from snoring, which is, again, an interesting non-aesthetic treatment, but one that works brilliantly and probably very appealing to you as dentists. Hair growth, so you can stimulate hair growth, hair restoration, as well as with the same laser you can actually reduce hair with the ND-YAG part of the laser. You can do the Photona 4D, which is this lifting. So again, if you work within the aesthetic industry, pretty much every patient comes in and they go, I just want this. With this, you can deliver that in a non-ablative way, and I'm going to show you how. You can lift above the eye area, you can smooth under the eye area, and you can tighten anywhere on the body. So I'm going to start off just talking about snoring a little bit. So with snoring, as many of you will know, it's the audible vibration at the back of the throat of those respiratory tissues. So this non-ablative erbium can be directed to the back of the throat to stimulate collagen. So palatal snoring is that type of snoring, and that accounts for about 85% of those people that snore. There are obviously other causes of snoring like nasal polyps and so on, and for those patients obviously this wouldn't work, but for the patients with that palatal laxity, this works really well. So in order to know how well you're doing, you need to establish a baseline. So we have a questionnaire that goes out to the patients, and we do a Mallampati classification, so we know exactly what's going on at the back of the throat pre-treatment. But the other thing we get our patients to do is to actually download an app called SnoreLab. And SnoreLab helps to monitor their snoring pre-treatment, so they've got an empirical reading as to what's going on with them. SnoreLab measures quiet, light, loud, and epic for those poor people that are snoring quite significantly, and then we'll treat them. So this night laze, this treatment works again by remodeling collagen, by breaking that helix of collagen, tightening further together and stimulating new collagen. So you're getting that instant lifting. So even during the session, whilst there's some laxity at the back of the throat, you can actually see that lifting during the treatment session, and that's where that remodeling is occurring. There's no pain involved in the procedure, and it only takes 3 sessions to see the results. So you have a day 1, a day 15, and a day 45 for your treatments. It takes about 20 to 30 minutes for every treatment session, and no numbing required. So you're aiming the laser at the back of the throat, And you're aiming it on different areas there. So you'll see from the next slides where you're going. So anterior pillars as well, posterior pillars and tonsils. And then this will just show you how you're moving the laser intraorally to stimulate the collagen. So with some patients, you can use a tongue depressor. Some patients have a gag reflex and it's harder to use a tongue depressor. So you can just get them to go, ah, which lifts that palate. And you get that lifting with the whilst you're doing the treatment, which enables you to direct the laser energy to the back of the throat. So this is an example of a patient that I've treated. So you can see down here, when we first started measuring, their score was 72. So they were quite significant snorers. On the Wednesday, we treated the patient on the Tuesday evening. On the Wednesday, you can see what the snoring is like already. And then by the Thursday and the Friday, significant improvement. And that's one treatment so far. So quite an impressive result. And then the second treatment you would do at day 15 and the third at day 45. So life-changing for a lot of patients when they've tried a lot of different devices already. The next one I'm going to focus on is smooth eye, which is lifting around the eye area. This is one of my favourite treatments. And again, very comfortable for the patients to have done. You're treating underneath the eye, to the side of the eye and above the eye. Smooth mode is super safe. If you remember, it's not penetrating through, so you can actually even use it on the eyelid without intraocular shields very, very safely. So these are the kind of results that you can expect from this treatment. So this is actually my eye going back 8 years, and my husband did this treatment for me as I didn't have a team at that stage. He's a gynecologist, and so this was way out of his field of expertise, although he does use the laser for treatments there. So if you want a really good result for smooth eye, get a gynecologist to do it for you. I had a great result there, but you can see the lifting here, and you can see the smoothing under the eye. And here again, you can see you get that improvement even if you've got some sort of laxity under the eye and almost bags under the eye. So it gives that tightening. And that's 3 sessions with the laser spaced a month apart. There's no toxin, no filler, no skin boosters, nothing else in that. That's pure laser. You can also stimulate the lips. So for those patients that are needle phobic and don't want to go down the route of filler, you can actually again use the laser for this. So you're plumping the lips, you're improving hydration. It's smooth mode, which is getting so smooth mode. Erbium likes water, so it's actually attracting then more water into that area. You're improving blood flow, so you're improving the colour of the lips as well. This is just a little video of how you do it, sped up, of course. Just shows you how simple a procedure this is, and the kind of results that you can expect. So from the younger patients to the older patients, you're getting a nice result of plumping. Again, this is 3 to 4 sessions, and you can see just nice volumization, again, of the lips. It's subtle but nice. So again, low risk, no risk of VO with this, and you're just giving a natural result to your patients. So if your patients like that natural result, which I think is the way that a lot of people are going, they want a natural result, then this is the way to go for those that actually don't want to go down the needle route. And then the Photona 4D, which is one of the prime treatments with the Photona, which is one of the ones that we love. It uses smooth mode, but starting intraorally. So you're starting inside the mouth for the treatment, stimulating collagen. So this sounds quite unusual. For dentists, you'll be very comfortable dealing inside the mouth. For the medics, it's a little bit more tricky for them to get used to. But the treatments are brilliant with this. So actually you're directing the laser light through an end piece. So sterile end piece going in, and it goes through the tube. It hits then onto this gold plate and directs the laser beam onto onto the mucosal tissue. And because it's mucosal tissue, it can tolerate heat really, really well. So if you imagine, you can drink your hot cup of tea quite comfortably in your mouth, but if you spilt that tea on your hand, it would feel like it was burning. Shows you can get high energy levels intraorally. And it's the heat and that high energy level that you need to be stimulating that collagen with the erbium. So you're aiming to get the energy all around this area, which gives really nice lifting of that nasolabial fold and the marionette lines. And here you can see some of the results using that treatment. So this again is no fillers, toxin, boosters, polynucleotides, nothing else. This is pure laser. And this is after 3 sessions. So they're nice, very natural results with improvements in those areas. So for those patients that really want to go down that route, don't want the needles, you can do this. However, what you can do is you could combine this with some of the other treatments. So what I tend to do now is I might do a treatment like this, and then if they needed a little bit of something else, then we could add in a bit of filler or treat with polynucleotides, and then you get an even better result with it. But these are pure laser. Again, here you can just see some nice lifting. With the laser at the end of the session, we use the erbium in its more traditional way, in an ablative way, so you're just taking off that top layer very finely in a fractional way. So that's how you're getting that depigmentation as well of the skin. So again, nothing else has been used, just purely laser. And then the hair stimulation, which I have to say I was super skeptical about when I first heard about it and thought, how can this possibly work? But it really does. And I've treated a number of medics, dentists, colleagues, as well as my patients with this, and they all rave about it. So obviously hair loss is a problem for men and women, and there's very little out there again that can help with this. You can use PRP and polynucleotides now. It's a little uncomfortable, but you can do those treatments. But with laser on its own, you get a phenomenal result. Combine that with exosomes, polynucleotides or PRP, and you get an exponential result. And so discussions with companies that are providing PRP and exosomes, I've shown them my results using laser and their products, and they've been amazed by the results and also the speed at which they're getting a result too. So how does it work? So you're using that fast shocking with the erbium again, smooth mode erbium, so you're not damaging the tissue at all. And that heat delivery then is promoting growth factors, fibroblast activity, and you're getting increased vascularization too. You're preventing further hair loss during this process, but you are awakening some of those hair follicles that haven't been working for some time. You can use it in patients that have had chemotherapy too, which is really rewarding. And as I say, you can combine it with PRP and other technologies too. Totally non-invasive. It does take 8 sessions, spread 2 weeks apart between each session. And once you've had it done, you can see some of these results, which are quite outstanding. So these results are purely laser, so nothing else has been used on these patients. But again, if you combine them, you could get even better results quicker. So with all of these patterns, you can see a really nice head. So these are my patients and these are my colleagues' patients. The Photona laser is super popular if you go over to the States and Brazil, and in the UK, the Photona laser isn't so well known as yet. And then I thought I would just touch on how the laser can work in a different way as well. So the laser can be used in an ablative way as well, if you so wished. So this was a patient of mine whereby she hated the moles that she had, and she didn't like the barcode lines above her lip. So I used the laser then in ablative mode rather than smooth mode. So it's using that erbium in that cutting way rather than the other way. And so we removed the moles and then treated with the erbium around those barcode lines above the lip. And we used that with the erbium in very short pulses initially to get rid of the moles, but then in slightly longer pulses with heat delivery that really helped to stimulate the collagen in those areas. So you can see quite a nice improvement, and that was just 2 treatments. And again, no fillers, toxins, no boosters, nothing else for those patients, or for that patient, sorry. And again, further skin lesion removals, nice and easy to do. So I think if you're looking to expand your practice and you're seeing these patients day in, day out, and you'll be noticing things on them, if you've got a device there that you can treat them with, it's fantastic to be able to say, yeah, I can do that for you. I could treat that for you. The problem is you start to notice your patients. You think, oh yeah, I could definitely do that. I can do that, and before you know it, you've got a nice long list for your patients. But great for them. They're not having to go somewhere else to get their treatments done. They're with you. You're seeing them, and you're taking care of them. And again, same laser, So not having to change your laser, exactly the same laser, using ND-YAG, which is the other part of the laser. And you can treat thread veins really successfully, so that's just one treatment session. And the active acne, which again is really difficult to treat, that's just 2 treatment sessions. For active acne, we would say go for 3 sessions just to maintain it. And then what you would do is perhaps every 6 months, you would treat again just to keep on top of it. So again, really nice results using purely ND-YAG then. Again, one device, and you're not having to invest again and again in further devices. So my journey was starting off with just one clinic and me, really, one room. And I knew nothing about devices at all, nothing about lasers. So don't be afraid to start learning. It is a whole new world, but it's easy to learn. I'm now involved with Photona, I do the training, and now I'm the director of Photona in the UK. But previously, when I first started 9 years ago, I had nothing to do with that particular business and just set up on my own, but it was my device of choice. Having gone through that process, what we now do for our customers is we hold their hands through that whole process, so I can share with you my journey, share with you the things to do and the things not to do, and we'll be able to give you all the training and support. So we've got a team of 6 of us that train, and we have our own engineers obviously in the UK too that are able to support your business moving forward. We help you with finance and we help you with your marketing too. So it's a different area, I appreciate, completely different to anything else that you may have done before, but don't be afraid to venture into that field. And from the dental side of things, again, it's a whole new world. So we are literally here. If you want to come and have a look at the devices, we can show you the dental laser. And we've got Lindsay here, who's just sat over there, who's our dental expert. And she'll be able to take you through the light walker if you're interested. And then if you wanted to talk about the aesthetic side of things, I can take you through that too. And we've got the rest of the team as well that will be able to help you. So by all means, if you've got time, pop over and see us. We can give you a little bit more information. And if you do want to get in touch or follow us on Instagram, then do so. You can see a lot more of our before and afters and what we can achieve with laser or blended technology. So thank you very much for listening. And does anyone have any questions? Good. Thank you very much. Thank you.